This will be our in-house training review of Cpap protocol and administration. First off, we're going to look at the Cpap protocol. It's found on page 163 of your Dane County protocols. And we'll look at what our indications are for the use of continuous positive airway pressure, or Cpap. We're looking for a lot of tachypnea, obviously difficulty breathing, looking for your retractions, those kind of things as well. And you're going to be, on our exam, we're usually looking for bronchospasm. One of the best ways of looking at this is going to be through your end tidal, analyzing your waveform from your capnography. You're going to see this shark fin-like waveform that is very indication of a reverse airway obstruction, which could be any kind of reason from COPD, CHF, and that kind of issue. We're going to see an increased respiration rate, 24 plus. As well as typically low oxygen saturation. This is seen a lot in our CHF patients who have pulmonary edema, fluid in the lungs. We're using a positive airway pressure to help push that fluid out of the way. Times you would not use this, never in a respiratory arrest or cardiac arrest situation, ago respirations, not going to happen. Your patient must be conscious, able to follow directions. So if your patient is unconscious and cannot follow directions, well, don't use it then. If you have any shock issues going on, with any cardiac insufficiency, so pump failure, we're going to make sure not to use that situation. Trauma to the chest or neck with the positive airway pressure, you want to make sure you don't have any kind of chest trauma, so looking at potentials, pneumos, those kind of things. They have nausea or vomiting. You have this mask on that's very, very tight, so if there's any vomiting issues, that's definitely a big no-no at this time because of the way the mask is set. Also, you can have facial anomalies, tumors, facial injuries, and if they cannot cooperate with the procedure. So the biggest thing here is the patient has to be alert enough to be able to have the mask on their face, follow directions, those kind of things. If your patient is not able to cooperate, is maybe too unconscious, too altered, can't do it. Also, does not work with a tracheostomy either. And so now we know when to use it, when not to use it. We have reviewed all these different facts. Let's take a look at how to actually use this device. We have our Cpap here that we use in the truck, found in the red bag, as well as the airway cabinet. Here you have a little head mesh thing, kind of keep the device on the patient's head. Here you have your face mask. Here's your regulator and your gauge to show how much liquid you're displacing with the water, with the positive airway pressure. Here's your medication cylinder, so you can use a dual nab or just albuterol in this as well, and also your oxygen tubing from here. Good thing to check out is this little yellow tag. It tells you how much oxygen to flow to achieve the maximum amount of fluid displacement. First thing, obviously, is to get the mask on that person's face, and obviously it's kind of scary. This thing is howling. It has a lot of air pressure on somebody's face. A lot of people don't like it, and so usually best is to have them kind of hold the mask up to their face so that they can get used to it. Try to coach them a bit. Tell people to try to inhale through their nose nice and deep for 4 counts, exhale for 1 count. Try to bring that air down deep into their lungs and try to move that fluid out of the way to help their breathing out. Once you get them kind of under control, you can then secure the blue clip and secure the mask to the person's face. Kind of get this, you can see the blue clip right here. We'll clip in that little notch to the face mask. Cinch it up nice and tight, so it's going to be a nice tight seal to the patient's face, and kind of adjust the head kind of cap as well in this case. You can tighten that face strap. There's a little gauge here to make sure we have the right setting over top of the nose. So you can set that so it's nice and tight over top of the nose, and then adjust the little straps on the cap headpiece of the patient so that they're nice and tight and that there's a good solid fit for the mask. Now just double check your setting here. If you are using just regular oxygen and the Cpap, you want to have the little green knob be vertical, okay, up and down, pointing towards red. I say red regular. Good way to explain it that way. That way you can make sure you're just flowing oxygen. If you want to deliver a nebulized treatment, so a dual nab or albuterol, make sure you have the little green knob turned horizontal towards the green. Also, if you're delivering any kind of medication at all, you're going to see this medication clouding up in the mask. Make sure you pop off these 2 little rubber stoppers here as a way to make sure we can get some flow as we're delivering that medication, but not too much flow, obviously. Make sure you ensure a tight seal on your face mask. Use your hands here to make sure if you can feel any kind of air flowing out from underneath the mask. If you do, tighten them up a little bit, cinch those straps down. You want to have a nice tight seal, and there's no escaping air, so you can achieve the best respiratory treatment for your patient. End tidal is a great tool to use with this. You probably already have this on your patient to help diagnose your bronchospasm, looking for that shark fin. You can leave the end tidal right on your patient. You don't have to worry about this little gap right here. The way that the mask is designed, if you cinch it down, you're still going to have to get a good seal, even over top of the nose prongs. Definitely use a nose prong device here. You can't use the inline. And help us to monitor patients' breathing, see if the waveform changes at all, watch your respirations. Good to kind of keep monitoring your patient and reassessing them to see if your Cpap treatment is being effective. Lastly, double check on the little yellow tag, which you'll find on the oxygen cord. It'll help tell you how many liters per minute of oxygen will be flowing to achieve your optimal amount of fluid being displaced. You're looking for 5 cubic centimeters of fluid to be displaced on average, and as you need to, you can turn up that oxygen then to increase if needed to help your patient breathe. It's a quick overview of CPAP, guys. We'll do a hands-on of this in our training night, as well as a checkoff station at the ambulance station. Thank you for your time and your attention.